Yang kedua, sekarang ni memang kebimbangan Kementerian Kesihatan melihat pada trend terkini situasi semasa kes-kes makin meningkat. Jadi kita juga berbincang apakah tindakan-tindakan yang perlu kita laksanakan. Yang pasti tindakan-tindakan ataupun strategi yang kita laksanakan pada 14 Oktober hingga kini, walaupun kita dapat mengelakkan lonjakan kes secara mendadak kepada 4 juta contohnya, tapi kita tak berjaya untuk menurunkan lagi kes, iaitu R0 masih 1.1 dan meningkat 1.2 dan sebagainya. Kita tak berjaya untuk turunkan kepada 0.5. Jadi kita perlu mengkaji semula strategi kita yang kita laksanakan daripada 14 Oktober hingga kini, dan juga tindakan kita untuk memberi kelonggaran pada 7 Disember, dan kita lihat sekarang ni ada pertambahan kes. Walaupun kita menyeru pada rakyat Malaysia untuk patuh kepada SOP, tapi kita lihat ada pertambahan kes sehingga hari ini, dan kita jangkakan kes mungkin akan bertambah lagi dalam seminggu dua, iaitu selepas tahun baru 2021 mungkin jangkitan akan semakin meningkat. Jadi kita perlu mengambil langkah-langkah yang seterusnya sama ada untuk mengkaji strategi-strategi baru dan berbincang dengan MKN sebelum kita boleh laksanakan.
In this new strategy, with ease of the significant advance, no more interstate travel, no more interstate travel, or even bringing back the MCO, is that also part of it?
Now we have learned the experience we have gained for the last 1 year. So now one size doesn't fit all. So now we look into the status, 14 days cases in the states. For example, we have a red zone, we have orange zone, we have a yellow zone, also we have a green zone. We have 6 strategies in place. Number 1 is border control. Whether it's the international border, whether it's the interstate border, or even inter-district border. That's what Sarawak has done in the past, inter-district border control. And that's number 1. So we need to tighten the border control. Second is that we need to look into our health system. If our health system is being pressured and we at a breaking point now, so because cases are increasing every day, so we may not be able to accommodate patients in our facilities. So this is, and we are looking into how we can enhance our healthcare system. But the best is not only enhancing our healthcare system, that means ICU beds or ward beds and etc., but to reduce the load. So that's second. Then third, we are concerned about public health action, whereby we track, we test, we isolate, and then we treat, and also surveillance and etc. So when the patient's volume goes up, so the activity in terms of our intervention, in terms of contact tracing and all that, that was probably will be delayed or even breakdown in terms of the public health intervention. And that's our concern. So that's the 3 things that we are trying to manage. The fourth is protect the vulnerable population, like for example, longhouses, orang asli. We have done that in during a second wave. Now we are looking into, can we protect the community, can we protect the Mukim district or even the state. State I mentioned, Perlis, Sarawak, and perhaps Terengganu as well. So that is our strategy for the protection. But we need the collaboration with all the public actually to come in to comply to the SOP. That's the fifth. And the final, the sixth, is actually to look into empowerment, public and community empowerment for them to comply to the SOP. So these are the strategies that we have. Now, looking into the cases now, and we need to re-look back again what we have done right and what we have done, probably not one size fit all. So we may consider red states and the green states differently in terms of strategy, rather than a whole nation, for example. So I think we are trying to finalize in terms of implementation, look into the cluster, look into the cases at the respective state before we take action. So it's more targeted approach rather than the whole nation, like what we did for in MCO on the 18th of March last year. It was a whole nation. But now I think our strategy will change. We are more localizing and targeting in terms of the implementation. So discussion is ongoing, and then probably we will make some decisions as soon as possible.